I'm Jordan Ravens, and I chose to do my project comparing the healthcare systems in the United States and in Afghanistan. So Afghanistan's healthcare system, they have no coordinated healthcare infrastructure. The Afghan National Security Forces do provide some care, but most of their care is provided through foreign aid. About 70% of medical programs were implemented by aid organizations. 72% of their total health expenditure is paid out of pocket, 5% is paid by the government, and 23% is paid through international partners. And they focus primarily on tertiary care. Preventative care is not something that most people seek in Afghanistan or have access to. For population health, I focused on infant mortality, which is a key indicator of overall population health, which shows in these numbers. So in the US, there's about 590 deaths per 100,000 live births. This is one of the highest numbers in relatively high in like developed nations that spend close to how much we spend. But still, this is much lower than in Afghanistan, where they have an estimated 12,900 deaths per 100,000 live births. But when you adjust this number for unreported girls, it's much higher at 15,600 deaths per 100,000. And this is partially because unreported live-born children are dead more often than reported. One of the reasons for this is because a lot of the time unreported live-born children are born in rural areas where they have really low access to prenatal care or medical care at all. And girls are often unreported because there is a stigma around having a family with all girls. So some families will underreport girls or report them as boys. And then also there's just a preference for male children in Afghanistan, so some people won't report them at all. And then a third reason is because some really conservative families will underreport the amount of girls because they don't want strangers to know that there's a high presence of females living in the house. So for healthcare spending, the US spends more than almost any developed nation. We spend about $10,348 per capita. And in Afghanistan, they only spend about $70.90 per capita. And I mean, one of the reasons for this is that people in Afghanistan don't seek medical care nearly as much as people in the United States. And then another reason can be contributed to the amount of advanced technology we use in the United States, whereas in Afghanistan they don't have access to nearly as many technologies as we have. One example is here at any major hospital or clinic you can get a ultrasound if you're pregnant, and in Afghanistan it's extremely hard to even find somewhere that has the technology to give an ultrasound. So also the way we pay for healthcare through private and public insurance and third-party payer systems raises the prices in the US, whereas in Afghanistan they don't have that issue. Our healthcare systems, I focused on prenatal care. In the US, 77.1% of women initiate prenatal care in the first trimester, and 75% receive at least adequate care, if not better. And then only 1.6% receive no care at all in the United States. So the numbers of women who get care in the first trimester or who get adequate care are both higher than the amount of women who even attend one prenatal visit in Afghanistan, which is about 60%. The recommended amount of prenatal visits per pregnancy in Afghanistan is 4, and only 16% of women attend this recommended amount. So these numbers are a key factor in why the infant mortality rates are so different in the two countries, among other factors. But as you can see, women are getting a lot better care and a lot more frequent care during pregnancy in the United States. For public and health prevention, I focused on HIV in both countries. The numbers of people living with HIV are obviously much higher in the US due to the much higher population overall in the US as opposed to Afghanistan. But one thing you can notice is that in Afghanistan, the amount of people living with HIV estimate number is much higher than the reported number. The reported is 2,131, whereas the estimate is about 7,500. And this underreporting is due primarily to a strong social stigma in Afghanistan, where sexually transmitted diseases are a really private and often neglected topic. Sexual education is limited, as well as resources to testing and HIV care. So many people don't talk about it or even know that they have it. And then, so in the US, 63% of people with HIV receive some type of HIV care, and 51% are virally suppressed. In Afghanistan, these numbers are extremely low, with 7% receiving ART and 6% at virally suppressed. In the US, there's much more access to condoms, a lot more education on sexually transmitted diseases, and a lot more open discussions about sexually transmitted diseases and how to care for them and how to prevent them. So it's managed a lot better in the United States, where in Afghanistan there's almost no discussion about it, which is why the numbers of people receiving care are so low. In the US, for example, like sexual education is started in middle school and high school. On campus, there's free STD testing available to students, as well as multiple clubs and resources for like giving out condoms or practicing safe sex. The physical environments of both, I focused on clean drinking water. In the US, 99% of people use safely managed drinking water sources or services. So if one group of people does not have access to clean water in the United States, it's a major news story, such as Flint, Michigan, where in Afghanistan that's not the case, and most people don't have access to clean drinking water. Only 27% have access to improved water sources, and that number is lower in rural areas at 20%. Reasons for this lack of clean water include geographical constraints, lack of education, war, and climate change. Geographical constraints and war are probably the two biggest ones. One, because in rural areas in Afghanistan, a lot of people don't have a way to leave their town, don't have a way to go access clean water. And then they've been in war for many years in their country, so a lot of the infrastructure has been destroyed or damaged. So a lot of people who used to have access to clean water no longer do. Access to care, I focused on the amount of physicians per 100,000 in both countries. The US has 271.6 active physicians per 100,000 people. 91.7 of these are primary care physicians, so about 79% of physicians are specialized. And even in the United States, we have kind of a shortage for physicians, which is a problem for access in America, but our numbers are still much higher than Afghanistan's at 29.5 physicians per 100,000. People in Afghanistan are lucky if they have access at all to a primary care physician or a physician of any kind. So specialized care is pretty scarce. I couldn't even find numbers on the amount of specialized physicians in Afghanistan. Also, most people aren't receiving specialized care if they're receiving care at all in Afghanistan, so these numbers are much lower. Social environment, I focused on single parent households. In the US, 23% of households with children under 18 have a single mother, and 7% of households have a single father. And these numbers are much lower in both categories. In Afghanistan, 5% have a single mother and 1% have a single father. Part of this is due to the fact that women are most often married really young in Afghanistan, and men have a lot more power in society. So single women have almost no power and no say in Afghanistan, so most families have a mother and a father. Also, divorce is it's really scarce in Afghanistan, so once people get married, they usually just stay married. So my key takeaways would be that in Afghanistan, there's no formal healthcare infrastructure or system. This makes it hard for most people to access healthcare. Most of their costs are paid out of pocket, whereas in the United States, most of our healthcare costs are paid by private insurance, which isn't really even an option in Afghanistan. However, they do have low spending per capita, whereas we have much higher spending per capita, but this is due partially to the fact that most people don't even receive adequate healthcare at all in Afghanistan, whereas here many people seek preventative care and also care for certain illnesses and disease. Also, the life expectancy in Afghanistan is much lower than in the United States, so people aren't living as long, and in the United States, most people spend most of their money healthcare spending on chronic diseases and illnesses, and once they're 65 and over, so people in Afghanistan aren't living long enough to be spending that amount of money. And then years of war and lack of access, education, and resources have led to extremely poor outcomes and poor health overall in Afghanistan. And these are my references.